4,000 pesos. 4,000 pesos is about 80 US dollars, about 58 pounds, and about 67 euros. For some, it's a cost of a fine meal, but for others, it could feed a whole family for a whole month. For everyone in the Philippines, this is the cost of knowing if one has COVID-19 or not. It's a great equalizer, doesn't discriminate. In every society worldwide and for centuries, a social class system has always existed. In pre-colonial Philippines, there were three levels of society. The Maharlika, where the rulers are handpicked from, the Timawa, or the working class, and the Alipin, or slaves. We've always carried with us our social class by the kind of garments that we wear, the ornaments that we carry. There's our social demeanor and many different ways. And people who belong to the same social circles tend to keep their own cliques and just be with each other. In Philippine society today, shadows of this class system has still been evident, right? And foreigners who visit or move to the Philippines classify the society as the most distinct when it comes to social stratification. Let's say holding a branded cup of coffee, for example, kind of elevates one's social status, right, in the Philippines. A typical Filipino lunch would cost about 70 pesos to 200 pesos if they feel like splurging, at least for a Filipino worker. But to get enough nutrients in one meal, a nutritious lunch would cost about 400 pesos to 1,000, which is a huge percentage of a regular income. Whereas the most accessible is very, very cheap, but it offers little to no nutritional value. And nutrition is very important for our brain and body development. Does this mean that only a certain percentage or segment of society has access to nourishment? The science of movement has evolved through civilization in time, from the time of gladiators and Roman hot baths to lasers and massage guns and sensory deprivation machines. Physical therapists, physiotherapists, and PTs, we've always helped people develop, maintain, and restore people's maximum movement potential so they can perform their roles in society. And every society needs their healthcare workers to survive. However, for developing countries like the Philippines, there's always been a phenomenon that's grappling communities like ours, and that's called brain drain. Brain drain is the migration of healthcare workers into greener pastures. And in the Philippines, it's been institutionalized. And for those who don't even want that life, they face a lot of ridicule and shame for not living to their full potential. But our colleagues who come from affluent backgrounds are spared from this because they go straight to medical school, whereas people who do not come from or inherit generational wealth are expected to bring their whole clan out of poverty, usually by going overseas. Is it always going to be like this? What is a typical career of a Filipino physical therapist before moving overseas? Right after graduation, everyone is funneled into the industry through volunteer work. Now, as altruistic as it sounds, it's not. The healthcare system and the recruitment agencies know that Filipino physical therapists will work for a certificate of employment for free. And so they abuse it, extort the most free labor from these people who just want a better life. And it's always been like that for generations and generations. Now, how do we expect healthcare to be world-class if the needs of people and their basic rights are not even acknowledged or valued? Humans have a hierarchy of needs, and it starts with food and shelter and moves up into safety and a sense of security and then a sense of belongingness, self-esteem, and only then can we live a full life by virtue of this metric. Most Filipinos never make it past the need for food. Healthcare workers, not just physical therapists, are respected but chronically undervalued in Philippine society. The Philippine Institute for Development Studies have published a study that classified Filipino income levels from families who make 219,000 a month are classified as rich minimum. And Filipino families who make 10,000 pesos and below are classified as poor. That is a huge gap between those two endpoints. And in today's digital age, the amount of disposable income that we have dictates the kind of technology that we have access to, the gadgets that we have, the Wi-Fi speed, our cellular data, access to private and open space, private space, and good headphones, etc. How come some countries get it right and we don't? Instead of gloating and envy, I convinced myself to be a little bit more constructive and think of strategies that worked for successful countries and tailor fit it to what's suitable to our own. Let's watch this video.
Klaro nga daw na bato ka to. Ay kamodera ko ha kamodera. Ilan. Takot.
Bayanihan is the Filipino spirit. And as you've seen, in the olden days, families who need to move locations would have the whole village lift their whole hut to a new location. And this hut could symbolize not just the house, but any ordeal that a Filipino family is going through, such as children's school fees, placement fees for overseas workers, and hospital bills. Filipino community would unite at a snap of a finger, no questions asked, to help a fellow Filipino in need. This is the core of who we are, and we've forgotten it. You know, alone we can only do so much, but together we can move mountains or houses. And that's when I thought when I was in isolation. I could have a better impact in society with what I do if I connect with physical therapists like me. And I cannot describe the joy that I felt when I got to know these superb and these star physical therapists in their own communities, lifting their own communities until they're empty, pouring out until they're empty. And so I connected with them and we thought of a strategy to pour out all together so we don't have to run empty. And this is the birth of our organization. We can now dream of a good life locally. We've decided to offer physical therapy in different tiers to give access to services to the rural mother who's tending to a child with cerebral palsy in the same way as an army general living in a gated subdivision, developing or improving his walking from stroke. We believe that we can bridge financial capabilities to people's maximum movement potential. And that's what we're doing as an organization. And It's refreshing for Filipino physical therapists to think that this could happen. Healthcare is for healthcare workers. Universal healthcare can only be achieved if our healthcare workers are looked after. And healthcare is for everyone. A good life is for all Filipinos, regardless of their socioeconomic demographic. This is our mission. We believe that if we can offer physical therapy for everyone, we already have lived a good life. And a good life is for all Filipinos. The business owner who has to keep his back pain away to keep his business running and provide employment. This team leader who has to keep her mental and physical state on tip-top shape to keep her operations afloat. And to the GP driver who has to avoid every kind of disease, such as heart disease, to keep bringing Filipinos to where they should be. Everyone's needs is equal and valid. We're good people. My fellow Filipinos, we're good people. Colonization and capitalism has faded those values and made us into selfish and greedy people who just are concerned about our own needs and disregarding the bigger picture in the community. That's not who we are. But it's not too late to come home. Uwi na tayo. Come home to our Filipino values. We're heroes. We're all heroes. And only then, when we know who we really are, probably we'll never charge for COVID testing again. And it's only then that we can truly, truly heal as one.